you're starting to record the meeting. So, okay, so just to start from the beginning, my name's Steve Warman. I'm the customer support manager at Clinical Skills, and my role is to help with train people on using the system and to deal with any issues or queries that come up and just generally help you make the most of clinical skills. And what we're going to be doing in this session is we're going to be looking at the user functions that you have accessed on the system, how you can use the guides, the assessments and the CPD area to record information. So there we are. Someone else is coming in. So we've got Mandy coming in here. Hi, Mandy.
Oh, hi.
Hi. Only just started. We're recording the meetings just so that you're aware, so don't feel you need to put your camera on. And I've just introduced myself as the customer support manager at Clinical Skills. And I'm just going to go through user functions on the website today, and we're recording it so the video will be available for later use. I'll say at this point, if anyone has any problems using the website, has difficulties logging in, or is asked to do functions that we don't go over in this meeting, by all means contact us at Clinical Skills. The best email is info@clinicalskills.net, and we'll be happy to help sort out any problems or provide any additional training that you need. So I'm going to share my screen. I'm going to do it carefully because the share button is right next to the leave button, which has caught me out a few times. So if I share my window, there we go. Can people see my screen?
Yeah.
To start with. Brilliant, that's great. So, okay, just to start at the beginning in terms of actually logging into your account. Now, looking at the system, quite a few people have already logged into the website, but some people haven't yet. Now, what would happen when we set up your users on the Clinical Skills website? Everyone will have received an email that looks a little bit like this, obviously with your name at the top. And there's a link here to click to confirm your account. And when you do that, it asks you to set a password and then log in. Now, unfortunately, the link here only lasts about 3 days. From the IT point of view, they don't like to have the link active for too long. So it might be if you've not already logged in and you find this email and click there, you'll just get a message to say invalid token or link out of date. What you do if that's the case is you go to clinicalskills.net. So just clinicalskills.net there. Click on log into my account, and then you have an ability to send yourself another confirmation instruction email. Sorry, the top one there. So click on that, put your work email address in, click submit, and you'll be sent a new one of those. And then once you've got that, click on the link there, and that will then ask you to set a password and to log in. I'm not sure if this one will work. No, this because I'm already logged in, it doesn't actually do it on this system. But when you go in, you'll be asked to make a password, repeat the password. You can then log into the website and accept the terms and conditions, and then you're into your Clinical Skills dashboard. As I said, if anyone has any problems with doing that, let us know and we'll work through it with you. Okay, so just to go into the actual website itself, once you've logged in, and I'm logged in here just as a user on my demonstration account. So I'm not actually using Bluebell Wood itself, its website. So all the information you'll see here is fictitious names and things like that. Now, when you come onto your Clinical Skills dashboard, you've got 6 tiles on the left-hand side here and a number of links on the right-hand side. Just to mention what the links are on the right hand side, latest updates does fairly obviously what it says. We're always updating our guides. We've got more than 500 now, and nearly 90% of them have been updated in the last 2 years. They've all been updated in the last 3 years. So we're continually updating the guides, so you can be sure that the guides on the system reflect the latest guidance and the latest national guidelines for whatever procedure you're looking at. So what we do is when we update a guide, we list it here. So we've just updated a guide on equilibrium and venting methods for reconstructing powder medications. We've done some medication errors guides and various other ones there. So you can see that there. Now you might find you've got an organisation quick links panel as well. Now in this area, this is where Bluebell Wood could actually pin links to particular guides to your dashboard that are considered important for your work in the organisation. And this is something that the super users can do on the system. And it just means that you can very quickly go to the guides that they've identified as being particularly important for Bluebell Wood. Underneath, you have an ability to add your own quick links to clinical skills guides that you find important, and I'll show you how to do that in a moment. Okay, so that's the stuff on the right hand side, which the quick links will make a little bit more sense as I go through, hopefully. Looking at the dashboard itself, the first area just quickly is my profile. And if you go in there, it's got your name, your email address, and some other bits and pieces. It's got your role in the organization, and you'll just have probably just a user role in one team. It also has the ability to turn on what we call multi-factor authentication. Now, you may have come across this on other websites, and if you turn that on, after you've entered your email and password, you have to enter a number from a phone or from an authentication device. You don't have to use that. If you want to learn more about it, there's a link underneath which will tell you a little bit about it. But if you want to sort of just increase the security on your account, you can use that. If you turn it on by mistake, let us know and we can turn it back off again. So that's really the only thing to mention on that page. Right, so the first main area to look at are the clinical skills guides, and that's in the guides area. So I click on the guides tile. I come into an area where I can see all the various sections of guides we've got on the website. So we've got guides designed for all healthcare professionals, regardless of what organisations they work in. We've got the adult guides, children, healthcare assistants, midwifery guides, which as a children's hospital, you might find some of the neonatal guides there and the breastfeeding guides, etc. can be quite useful. Mental health, etc. So there's a whole range of sections of guides. And if you go into a particular section, you see the various categories of guides all listed down here. And if you go into a category, you'll see the guides in that category. Now you can search for a particular guide by topic. So for example, if I go for diabetes in the top there, I'll see all the guides that are related to diabetes on the website. What you can also do as well is if you prefer to see the guides just listed as text, you can use the See All Guides button here on the left. So if I click on that, the guides are then just listed down the page, again divided by section, and then by category, working down the page like this. And you can have a look at all the guides this way. And again, just click to go to a particular guide that you want to look at. And again, you can search for a guide at the top. So I'm going to search for, I've had a quick look on your website, and the guide that's been used the most by Bluebell Wood so far is the Roots of Administration guide. So I'll have a look at that just as an example of what the guides look like. So if I type the name of the guide there, I've got the Roots of Administration guide there. Again, you could search for diabetes or blood pressure or whatever particular topic you want, and it would show you all the guides that are related to that. So I go in and look at the Roots of Administration guide to start with, just to give you an idea of what the guides look like. I'll come back to all the little bits at the top in a minute, but let's look at the guide itself first. So the guide opens up as a PDF within a panel in your browser. Now I'm using Chrome here as the browser. If you're using Edge or Firefox or Safari or whatever else, it might look slightly different, but the PDFs will still be displayed in the middle of the page here. You'll have some way of making them bigger, so you can make them bigger like that or smaller, make them full page more like that. You can even, if you're feeling a little bit sleepy, you can do that and have a read while you're lying down. So there's all sorts of things you can do with the guides just to make them easy to look at. You can jump to particular pages on the guide by clicking on the sidebar here and then just picking the page you want to jump to. So that makes it easier to get around the guide. You can also download using the buttons on the right here in Chrome. You can download the guide. You can print it out. As long as you don't distribute it outside Bluebell Wood, or obviously, try and sell it as your own material, you're very welcome to download and print the guides out. The only thing we say is because we update the guide so frequently, it's always best to come back to the website to make sure you've got the most up-to-date version. So looking at the guide itself, and I'm just going to make it a little bit bigger. We've got obviously the title here. The author of the guide. Now, all our guides are written by subject matter experts, normally senior nurses or nurse lecturers, or people who've got a lot of experience in practically carrying out the particular skills. All the guides are double-blind peer reviewed as well. So that means they go out to other subject matter experts who don't know the authors. They give their comments on the content, and we work through quite a process to make sure we can reconcile the guidance from the author and also from the peer reviewers. The guides themselves, they all start off with some introductory material here, which tells you a little bit about why the procedure is important. Everything is referenced, so you find going through there's references, and there is a references list at the end, which I'll show you in a moment. And once you've got past the introductory material, the rest of the guides are very highly illustrated. So the idea is to show you, for example, with the enteral routes, what equipment you might use here, to go through the different routes of administration of medication, oral mucosa, buccal, etc. And just to generally sort of illustrate what we're actually talking about, also supported by text as well. So you've got a lot of detailed information here. We also try and include a little bit of anatomy, just so you can actually see what's going on under the surface and get some understanding of that side of it. And talking things, things like you can split scored tablets, but obviously you shouldn't crush or break coated or unscored tablets, because obviously then you may end up with uneven distributions of the actual medication itself. Just going through, how to measure liquid medication, simple things like put yourself at eye level when you're looking at the level of the liquid in a container. How to use, the syringes and things, and also filling in, looking at any special instructions, for example, going through. So hopefully, all fairly basic stuff. Here we've got the nasogastric and gastrostomy tube. So again, you can see a little bit of anatomy there just to show you, where the thing is actually sitting. Obviously, with enteral feeding tubes, you've got to check the pH to make sure it's not in the lungs or somewhere you don't want it to be. And again, just going through the basics, rectal administration, for example. So hopefully you can see the guides are fairly, fairly straightforward, fairly obvious. And the idea is just to make it easy for you to understand what you should be doing and how you should be doing it. And there's other guides as well. For example, with eye medication, we've got a guide specifically on installation of eye drops and how to do that, for example. So there are other guides that help as well. So I'll pause at that point. Any questions at all? It's mainly so I can have a little sip of water here.
No, sounds really clear.
Right, it's not gin, it's generally water, but there we go. Oh, they would say that, wouldn't I? Okay, so going under the guide, there's a few other little bits and pieces that might be useful for you as well. We've got the aim of the guide. So just to give you an idea what the aim of it is, what the learning outcomes, so what, having read the guide, you should understand, how it maps to NMC standards. This is obviously to help with revalidation. When you do your revalidation, you can see, having read this guide, how you could actually record it as part of your CPD activity. And we do have a module available to you on the system, which allows you to record your CPD activity following the NMC template. And I'll show you that a little bit later. References, as I said, all our guides are referenced, and you've got the references list down here, and you should be able to click through to the actual original article and what's this doing? Loading publication. There we go. So you can go through and actually look at the article itself to see what it's about there and do some more research. We also have a key reading area as well, where we've just tried to pull it down to the few guides, the few references that are key if you really want to go into this in a bit more depth. The author information I already mentioned. So Martina is a senior lecturer at Brunel University Hospital, and when the guide was last updated. So this one was first written back in 2012, and you can see it's been updated several times since, with the last update was May last year, so about a year ago. So this time next year, it'll be coming up for review, really, unless any new national guidance comes out, in which case we would update the guide to match that national guidance. The thing we always say, if you do read the guide and you think, oh, that doesn't seem right, or that seems a bit out of date, do contact us and just mention it. It might well be that we actually come back and say, well, this does actually follow local national guidelines, or it may be that there is something that we need to have a look at and update. So we're always welcome to get feedback on the guides, and it's always useful. Even if we can sort of say, well, no, that's fine, it's just good to have that feedback, and then so we can look into it and make sure we're doing things correctly. Okay, so above the guides, there's a few little bits and pieces as well, which I'll just go through. As a user on the system, you have the ability to add personal notes to the actual guide itself. So that might be, those will be notes that only you'll see when you come to this guide. And it can be something practical like gloves are kept in the bottom drawer, or whatever you want to put there. And that's something that you'll see that no one else will see on the site. And when you click OK, that will appear there at the top of the guide whenever you come into it. Now, your organisation can also add what we call organisation notes. And this would be a note that would be added by the super users in Bluebell. And it would be something that pointed out, for example, maybe the equipment was different to what was shown in the guide, or it might be a link to a local policy, a local infection policy, or something like that. So always have a look at the top here and see if there's organisation notes that you need to refer to as well as read the guide. A few other things you can do. If you're trying to use the guide on an iPad, the Open Guide in New Tab button works very well. That opens the guide up and it gets rid of all the buttons above and below the guide and just gives you the guide itself. So that might work better if you're using it on an iPad or a mobile device or something. You have a way to jump straight across to the CPD area here, which I'll show you a little bit later. All that information under the guide, the references, the key learning, the NMC standards, etc., you can download those by clicking on this button. And when you click on that button, the references, key reading, all the other bits are pulled together into one PDF, which you can then download for your own reference. You can see if there's any assessments associated with this guide, and I'll show you those in a little bit as well. Right at the start, I mentioned quick links. Now, if you click that toggle there, and I go back to my dashboard and go across to the right hand side under my quick links, or your quick links rather, I will now have, there we are, the Routes of Administration guide is now pinned to my dashboard. So if you've got a few guides you'd like to be able to get to quickly, you can just pin them here and then jump straight into them without having to search for them through the box. And as I say, when you open it, your personal note appears at the top there as well. If you want to share the link with anyone else, click the share link button. And you can share this to other people at Bluebell Wood, and that will enable them to open the guide once they've logged in. Don't copy the link at the top here, because that sometimes has information about the user's role in the organisation and other stuff. But if you click that link, that will be one that other people can open the organisation there. So that's the basic buttons at the top there. Any questions at that point? Nope, that's good. Brilliant, that's lovely. So what I will do is I'll show you one other guide, because there is one other feature that that can be useful. And another guide that's been popular at Bluebell so far is the measuring blood pressure in infants. So I'm going to have a look at that, and I'll just show you one other thing. So measuring blood pressure in infants. So there we are, measuring blood pressure in infants, children, young people. Now, if I open this guide, there's one other feature which this guide has got, which is a lot of our guides have got, which is a checklist, what we call a competency checklist. Now, if I open this, what you'll find is it's a downloadable PDF that you can use to actually assess someone's competency on a particular procedure. So in this case, you would have someone who's experienced in taking blood pressure in infants, children and young people, who would then be watching someone who was going through that process to see what their practical skills are. And the idea is that you download this, you print it out, and then you can watch the person going through the process. Things like, have they explained the procedure to the patient and parents? Have they decontaminated their hands? And just goes through all the various steps, attaches the cuff appropriately, rests the patient's arm. So it just works through every step there to see if they're actually doing the process correctly. And at the end of this, there's usually a couple of questions, or here we are, we've got 4 questions here, which the assessor can ask the person being assessed about the process, again, just to check the understanding of the procedure. Now, at the moment, these are downloadable, you print them out. We are introducing a new system on clinical skills, which will be an optional upgrade, which will allow these to be done online. And that's something we'll be rolling out and doing demonstrations of over the next couple of months. But it is an optional upgrade. If you don't go for that, you'll still have the access to the downloadable checklists for you to use as well, and then to store locally. So I hope that makes sense. So that's the main thing I wanted to show about that guide. Apart from that, you can see the guide is very similar to the one I've just demonstrated, the introductory material, and then lots of pretty pictures to sort of illustrate exactly what size, things like getting the appropriate cuff size and things like that. Okay, so if I go back to the dashboard now, that's guides that we've covered there. You can use the breadcrumbs at the top here to jump directly back to a particular part of the website, or you can use the dashboard button at the top there. The next area I'm going to have a look at is the assessments. And we've got a whole range of assessments on the system already. The standard assessments we've got, these are assessments that we built at Clinical Skills, available to many different organisations. Our clients also have the ability to build their own local assessments. So Bluebell could actually generate some local assessments on the system that would be just available to your staff. Now, this is something that would be done by the super users or the managers, but if you do get involved in building local assessments and you want further training on that, just let us know and we'll be happy to go through and look at that. The same if you're asked to get involved in things like generating reports on the system or changing the content. Again, that's something you can do as a super user. Let us know if you need that training and we're happy to provide that. So I look at some of the standard assessments here. So these are the ones that we built at Clinical Skills. And for example, they're all listed down here, so you can just grab them from the drop-down list, or you can search for assessments by section and category. All our standard assessments are linked to our guides. So for example, if you wanted to look at an assessment, for example, on catheterization, I'd come into the adult section and then the catheterization category, click search, and I would see what assessments we've got on the system on catheterization. And we've got two. We've got one catheterization general and one specifically for carers. So to start an assessment, all you do is click the tile, click OK. It'll then take you into the assessment and it'll give you an introductory page which tells you about the assessment, how many questions you've got, and also which guides it actually links to. And if you want, before you start, you could just jump straight into the guide and have a look at the guide before you actually start the assessment. So here we've got a catheter care one, which was updated last year, which again goes through catheterization in detail. And when you're happy, and you've read all this stuff here, you can continue to the first question by clicking the continue to question 1. And then simply work through all the questions. Questions are listed on the left. You can jump directly to a question, or you can just work through them one by one. The questions are different types. You could have true false questions like here. So for example, if we put that one there, for example, false. If a female healthcare professional is passing catheters, no need to ask if the patient wants a chaperone. I think that's false. I think you should always ask if they want a chaperone and not just assume. If you go to this question here, for example, this one is a multiple choice question. So I'll just grab a couple of answers at random just to show you how it works. So do that there. And you can just work through the system. This one we've already answered, and all the way down until you get to the last review and submit answers step. You then have the ability to change the answer that you put. So if you wanted to change that, you could click there and then change that. If you've missed any, you have the chance to answer the question. And when you're happy that you've done as well as you can on that, come to the bottom, click submit my assessment, and then straight away you'll get feedback on how you've done. And we got 2 out of 24. So I was right with that one. That's quite good. And I got the first one right just by random. So straight away you'll get indication of what the correct answer should be. You may also get additional feedback as well to explain why the answer is correct. We have some question types which test your ability to work out the dose of medication. So to work out a dose of medication and the correct unit to go with it. So milligrams, milliliters, whatever. And sometimes when we have those questions, we include feedback that go through how to work out the answer correctly. So that even if you get it wrong, you can see how the correct answer should have been arrived at. So that's there. So you can retake the assessment from this screen as well. And at the top, you get information on, what the pass mark is, when you last took it, and how many retakes you've got. And I've already used 9 out of 10 retakes on this, so I won't be able to do this much longer. So that's the assessment side.
Steve,
when you
can I
Yep.
just ask a question? Sorry.
Of course, yeah.
Do the clinical educators or a manager get notified if somebody's took 10 times to say pass meds management or something like that?
Not automatically. They can run reports on the system to actually see
Okay.
how people are doing. And if that's something you need to do, I can go into that. I could do it now, or we could have a follow-up meeting to go through the super user and manager functions. But
Okay.
they don't automatically get notified. That's something
Okie
that
dokie.
I think a lot of organizations will run sort of monthly reports just to see how people are doing. Um,
Yeah.
Generally, I would say if someone's used up 10 retakes and they're still failing the assessment, then there's a problem somewhere, either with them or with the assessment itself. So I can understand you
Okay.
want to look into that. So
Yeah. Okay. Thank you very much.
okay,
Steve,
brilliant.
this was
Yeah.
my question. If after 10 attempts we still fail, what's the procedure then? Like you said, it could be problem with the person, or do we need more input, like from education team, or what will be
I
the
would
next
stick.
steps?
That's probably, I mean, something for your sort of internal training. I mean, in terms of the
Right.
technicalities, you super users can reset the number of reset the accounts back to 0 so that they can
Yeah.
actually retake it again. But I'd suggest obviously you'd probably want to look internally at whether
Yeah.
the assessment was appropriate. Certainly if it's a standard one, you might feel that's not really appropriate for your needs, or to see obviously if it's just that individual user who's got a problem. But what some organizations do is they take the standard assessments and look at them and say, well, they're not quite right for us. So what we'll do is we'll adapt them into a local assessment. And what you can do is you can duplicate the standard assessment to make it a local one, and then you can edit it to make it exactly what you need. And as I say, that's the process we can go through and show you how to do if that's what you want.
I
Okay,
think
thank you.
I would say with the assessments, it's best to sort of work from the basis of what you want to have as assessments on the system, get it structured, and then look at what's available and whether you want to alter that content. Some organizations will just leave it open and say, yep, anyone can take any assessment they want. Other organizations have a much more structured approach. And with assessments, both the standard ones and the local ones, you can allocate them to particular teams. So if you've got a particular team that needs certain assessments, so a team being a group of users on the system, you could allocate the assessment to them specifically and not to other people. Again, happy to go through that with you if that's going to be useful. So
I'm just wondering if we need to speak to the clinical education team around how they're going to be utilising this part of it, because I know there's some work being done on assessments and things. So
that would be good. Yeah, it's best to be structured. And if you've got a clear idea of what you
yeah.
want to use the system and what you want people to do and not do, then you probably that would get the most out of it. I would suggest.
Okay.
So,
Thank you,
but
Steve.
yeah, and happy to help with that if we can provide any further advice. So
Thank you.
Mandy,
Kate, yeah.
I've got Jo Stout's just joined me as well, because she froze when
Yeah.
she tried to join, so she's just listening as well.
Yep.
She said she's having, from conversations with Bree, it seems that they're hoping that maybe the assessments can sort of like become the competences.
Yes, it was just the I just would prefer it to be flagged up to say if somebody had failed meds management 9 times and passed on the 10th, that's quite a lot.
It is, yeah. I mean, so you can run reports on the system,
Yeah.
and I can show you that if you want. Let me just quickly show you that, because that sounds like it might be something that's useful. I've got, yeah, I'll come back a couple of areas to cover as a user, but if I go into, on this demonstration account, I can change to being a super user. But as a super user, you can go into the, where's it gone, the reports area. You then have an assessments report function. And if I click on that, I can then search for assessments by particular dates. So for example, if I wanted to search on assessments that have been completed over since the beginning of the year, I can just grab a date range like that and bring it back up to today. God, I can't believe it's nearly June. It's amazing. Click search. And then you've got a list of all the assessments taken on the system. I've only got a couple of accounts on this because it's a demo, but you can see there's Jim here, there's Alison, and you can search for those who've actually failed. So you can have a look for failed, and then you can see how people who failed on the system, and you can see some that are, though you can also select for those that cannot be retaken because they've used all their retakes up. And I haven't got any examples here. So you could actually do a search to see who's on the system and used all their retakes. But unfortunately, it's not automatic. You'd need to come in here and do that on a sort of regular basis.
Steve, is that
yeah.
something is the amount of retakes you can have something you set up locally then?
Yes, you can. I mean, the standard ones that we set up all have 10 retakes, but when you create a local assessment, you have a lot of control. You can specify the number of retakes. You can specify it so there's no retakes, and you can do things like you can withhold the correct answers. You can make the assessments random or compulsory with compulsory questions, and you can set the pass marks and all those sort of factors as well. So that's something that you can do. So sounds like that would be good. I think I went over this with Bree briefly, but it sounds like an extra training session would be useful just to look at what you can and can't do with the local assessments. Is that okay? Yeah.
Sorry, perfect. I was just trying to get my microphone on there. Thank
Oh,
you
that's
very
okay. No, it's
much.
okay. So no, it's try with the screens off. I can't see if people are asleep or what they're doing. So, but when you're presenting live, at least you can see the reactions. So when people start looking at their watches and tapping it to see if it's still working, you have to wind things up. But there we go. Okay. So that's touching on the super user functions. So for those of you who are using the system as a user, this is not something that you'll need to do regularly. So what I'll do now is I'll go back to being a user on the system and just look at that side of it. So I'm back to being a user on the system. So we've looked at assessments. The next area I'm going to look at as a user is the My Performance area. Now, when you've taken an assessment, you find that they're all listed in the My Performance area. So this is a list of all the assessments taken on the system. This is the categorization one that we've just done. It tells you how you've done on the system, whether you've got retakes available. So you've got 1 out of 10. There's only 1 retake available left over on that. You can have a look at the go in here and have a look at the answers you put. You can retake the assessment from this screen as well. Now, if you passed an assessment, so if I just filter for passed, you have the ability to download a certificate to show that you've actually passed the assessment. So if I just quickly download this one, put it somewhere sensible so it won't confuse me, you'll get a nice little certificate which will have your name there, the name obviously of Bluebell Wood there, and also the name of the assessment and how you did. So you've got that certificate you can download. Now, super users, you can run reports. You can also download these certificates for your own records as well. So that's just something that can be useful there. So that's the My Performance area. So you can see how you've done on the system. So does that all make sense? I'll assume, yep. No answers, I'll assume yes. The one last area I'm going to mention from a super user point of view is My CPD. We have an area on the website which is private to you. The super users cannot see this. They cannot run reports on this. But this is an area where you can record your own CPD information. And it's laid out to follow the NMC templates that you would normally use if you use the NMC for revalidation. You have the ability to add several different record types to here, and you can add as many of each of these types as you want. So you can add an NMC CPD record, reflective account, reflective discussion, practice-related feedback, and practice hours log template. And as I say, you can have as many CPD records as you want. And if, for example, if I have a look at a CPD record I've created just to show you what they look like, this is one I've created just to cover infection control. And I come across to the actions button here and I can edit it. And the records start off with the sort of general NMC information that you're probably aware of, with links to more information about standards of proficiency and also additional revalidation information. And within that record, you can record as many log rows, we call them log rows or just information, about the activities that relate to the topic of the CPD record. So this one's about infection control. So I've made a note here about some online learning where I read several clinical skills guides about infection control. I'd attended a face-to-face course back in January last year. And then we'd had a ward infection control meeting. And within each of these rows, you can record the links to the various code items that you need to put, and also how many hours and how many participatory hours that activity involved. And you can add as many log rows as you want over as long a time period as you want. So it's up to you how you structure your records. You could do it by topic, or you might say, well, I'll just put 2026 and I'll record everything there. When you're ready for revalidation, you can download the record using the download button. And again, I'll just save that somewhere on the computer. When it comes down, it's already formatted out as a PDF in the appropriate layout for the NMC form. So again, with the information at the top and all your log rows listed at the bottom and your hours totaled up as well.
That's brilliant.
But yeah, I think a lot of people find it's a very good way of saving time.
Yeah.
Our clinical commissioning editor is a working nurse herself. She has a day or two a week as a nurse, and she uses this system to record all the information as well. And the same happens with the reflective account. So, for example, if I go back to my CPD records. I can look at reflective accounts, and again, they're laid out to follow the standard format, and when you download them, they come out looking as they would do when you submit to the NMC. The other nice thing as well is that at the top here, you've got some search boxes. So what you can do is if you want to say, look at the log rows, what you've done over a certain time period, searching all those different log rows, you can set a date there. So from, going right back to 23, or you could just do the last year or so. So I can set a date range there. And then it shows you how many hours you've got within that date range, your participatory hours, and also how many reflective accounts. Obviously, I haven't got a lot here because this is just my demonstration organisation. So hopefully that's something you'll find useful. I say it's personal to you. It's not viewed by the super users. If you do move to a different organisation, and I don't know why you would want to leave Bluebell Wood, I'm sure there's no reasons, but if you move to another organisation that subscribe to clinical skills, we can move your record across with you. So your CPD record and record of assessment you've taken would go with you. And also if you come into Bluebell from a different organisation that can subscribe to clinical skills, we can bring your record in. There's also a personal CPD area here. When I click on that, and that's just to allow people who don't use the NMC format to add CPD records. It's more generic. You can come in, you can add 2 record types, personal CPDs or reflective accounts. And if you go into a personal CPD, you can add log rows to that record. And within each log row, you can add as many additional information fields as you want. So it's more of a sort of generic layout to enable you to sort of just record information that doesn't go to the NMC. And you do have people who revalidate with other bodies, so they may find that useful there. So any questions on that?
No, thank you.
No, that's lovely. Thank you.
Great. So the only other area to mention with the super users is that there is a help area, which we're building and expanding all the time. So you can go into it through the help tile, or there's always a help button at the top here. And looking through here, there's an introductory video. There's a whole load of links for people who are on the website as users, where they can go in, for example, and look to how to find and use the guides, to competency checklists, some of the things I've already mentioned. There's also entries for super users and managers as well. So if, for example, you are on as a super user, how to use the reports area and how to alter the content available to the individual accounts on the system. So I think that's pretty much it. Do you want me to have a look at some of the super user functions, or would you rather save that for a sort of a practice educators meeting to go over that in more detail?
But the practice educators had this super users training already.
I think to be honest, I'm quite sure. I think I did a session with Bree.
Okay, yeah.
Kate, were you involved in that one, Kate? I'd need to check back. If not, then it would be good to organise a session or maybe a couple of sessions, and maybe record it to go over these functions in details.
Okay.
But I'd have to check back with that. So, but let me just see. I've got a note of what I've been doing, because I've got a memory like a thing with holes in it. What do you call it? So I do tend to. I do make a note. Well, the thing is, we deal with a lot of different people, so I do make notes of things. So just because we've got other people involved in training and support and stuff. So I think we did do something. I'll contact Bree just to make sure that we're covering the practice educators and see if there's any more training needed on that side, just to make sure you can use the site effectively.
Yeah, because then we can get together and decide. They may have already decided all this, but
that's the thing. But it is, I think, the main thing. I'll stop recording now because I think we're okay. If I just stop recording, just stop that.